Welcome back. Second drug we're going to be talking about is also a statin. It is Simvastatin, also known as Zocor. So again, it's a statin and it's also an anti-hyperlipidemic. So what this is going to do is also have that HMG-CoA reductase inhibitor, which is going to therefore lower our bad cholesterol and stop the buildup of fats, triglycerides. We're going to use this if you have high cholesterol. It's going to help prevent heart disease, attacks, strokes. You want to be careful and have precautions if you're on this drug. Don't want to have a lot of intake of alcohol, as that will increase your adverse effects. It's not recommended in pregnancy or breastfeeding, or if you have any sort of liver problems. Lastly, on this slide, for administration of this drug, you can have it in a tablet or suspension form. If you're going to take it in a tablet form, you want to take that with or without food, but take it with water. And for the suspension form, you want to shake that before using and make sure you're on an empty stomach for that one. All right, continuing Simvastatin, also known as Zocor. We're going to skip to complications. There are a lot of complications with this drug, as there are a lot of statins. A lot of them include respiratory infections, abdominal pain, nausea, headache, UTI, insomnia, jaundice, and rhabdo in severe cases. And if you take a very high dose of this drug, I believe the highest is 80 milligrams, it can cause muscle pain and weakness. So some interactions, again, we have grapefruit, and then digoxin, blood thinners, phenofibrate, antifungal, steroids, cancer meds, and other statins. With a lot of the blood thinners and digoxin, you want to be careful because you can get a lot of digoxin toxicity with that. You also just want to watch a lot of the interaction risks, and same with steroids and cancer meds, you're going to be able to have a lot of more muscle weakness with that. And lastly, as a nurse, we're just going to educate our patient, adjust the dose and monitor, and we're always assessing those cholesterol levels and seeing if we need to adjust from there. To finish up Simvastatin, we're just going to talk about what we would educate our patient on. So we're going to want to tell them, don't take more or less, take it just as prescribed, again, same time every day. Also, just hit it hard. They want to avoid the alcohol to avoid those adverse effects. And then lastly, to know if the drug is working, within 4 weeks, your cholesterol levels should drop. And then something I just threw in here too are to take frequent blood tests often to make sure that your liver and kidneys are working because of those adverse effects, and you wouldn't want to take this drug if you did have some liver problems. So just to ensure, you're going to want to get frequent blood checks. And that's all.